I think this is the
Yeah.
most important thing we can teach patients.
Yeah.
And I think this is the most important thing I learned.
There are numerous data, probably 40 or 50 peer-reviewed publications now, showing that COVID opens the door to many other infections. The child will have a developmental delay. They were mentally incapacitated by all the brain inflammation, and they had access to a hyperbaric system. And they said, would it be safe for a less than 1 month old baby? And
Why would the second twin go inside the chamber? Has hyperbarics found its place?
I think it's on the way. This is a collaborative therapy that will make all your other things that you do work better.
Hello, and welcome back to Hyperbaric Living Podcast. I'm your host, Dr. Masha. Today, I have with me a very special guest, Dr. Paul Anderson. I'm a big fan of Dr. Anderson. I'm watching his video on YouTube, reading your articles. Thank you for creating all this content. And Dr. Anderson is a naturopathic doctor like myself. He taught at CCNM, but that was a little later. I graduated and I left the country, so we didn't coincide there. But we met at IHA conference, at International Hyperbaric Conference, where we both spoke. Today, we're going to be talking about COVID, long COVID, and other infectious diseases. Welcome to the show, Dr. Anderson.
Thank you for having me.
I have to ask this question. So what would be more appropriate treatment if a person got COVID?
There are numerous data, probably 40 or 50 peer-reviewed publications now, showing that COVID opens the door to many other infections. And they can be things that before COVID, your body maybe had a little bit of and had no problem with, but after or during COVID, as your immune system is suppressed and you're inflamed, opportunistic infections can take over. I think they're extremely important because what we know now is wherever your weaknesses are immunologically, COVID sort of opens the door there. And so if you tend to get respiratory bacterial infections or fungal infections or other things, those become a big problem. And to the degree that the very few, and I'm talking about just a handful of people that I've seen over the years who went to the hospital and then passed away, all of them were diagnosed with other infections, but too late.
What kind of infections are you referring?
The co-infections can be literally anything. Okay, so there are some commonalities such as Epstein-Barr and cytomegalovirus, two of the human herpes viruses, but really the whole family. Candida is common. The chronic atypical pneumonia organisms like chlamydia and mycoplasma pneumoniae are very common and do need to be treated because it will keep the inflammation in the lungs going. But also in research from all over the world, they've found some of the what you might call higher grade pneumonia organisms like strep pneumoniae, Klebsiella, some of the other bad guys. And then some, in the case of some of the patients I've seen in the hospital, some very unusual either bacterial or parasitic infections that aren't considered chronic, just the immune system was suppressed and the person got infected. So just about anything you can have can potentially piggyback on top of the COVID.
If co-infections are being taken care of earlier in the treatment, then we see less progression to long hauler. What it is, a person has recovered from COVID, but they continue having some of the symptoms, or they might develop some strange symptoms that they never had before and not even had during COVID infection.
Right. Because a lot of times the hormonal system gets very stressed during COVID. And so your adrenal hormones like cortisol may either go really high or really low. Either is not good for you. So checking into those, most doctors are not checking into any hormones, either during COVID or in long haul. And what we find is that the inflammation in the body creates a lot of stress on the adrenal glands and their hormones, but also That creates a lot of stress on thyroid function, which can lead to a lot of the fatigue and some of the other things that happen. And even if a person's been sick for a while, some of the reproductive hormones can get out of balance as well. You have some people that have mild illness, but it persists. So they really don't get that sick with COVID, but 2 months later, they're still having neurological problems or other long COVID effects. And the statistics are still emerging, which makes it very hard to generalize, about who gets long COVID. The only statistic that has been persistent is that if you have been hospitalized, which means you probably were pretty bad, those people have a very high rate of long COVID. When we treat people early and attend to their co-infections and their inflammation and their hormonal changes and any other things that come up, when we treat them early, we have almost no long COVID. Okay, so that's one thing. But the other thing is that in people where, let's say, they're an outlier and they had very low disease with COVID, but they're still sick 2-3 months later, usually what happens in those folks that I'm finding now is the low disease state COVID, as we talked about, opened up the door to other problems, whether it's hormonal or co-infection or toxic, et cetera. And so they're just still dealing with the problems down the road. So it's more like, I think long COVID comes from not so much how sick you are with COVID, unless you're hospitalized, but really, what does COVID do to your immune system and what does it let in when it's there?
What would you recommend to someone who's had COVID and developed long COVID and they're struggling?
The best answer to the question, which is the hardest, is if they can find a doctor like yourself, me, somebody in our world who's more likely to look at a bigger picture, they're more likely to get help. Okay. And I don't know any way around that really, because it does require some effort to try and, if you've been sick for 2, 3, 4, 6 months, a year, it's going to require some effort to figure out what weakness areas the COVID has stirred up in you and what you should do about it. Physical movement seems to help on a lot of levels, but you got to do it very slowly and steady. We find a lot of times that if you can work with someone who works constitutionally, meaning they look at your whole system and what it needs, constitutional, herbal prescribing can be very helpful. And then, of course, if you can see somebody who does integrated medicine, whether it's a naturopathic doctor or medical doctor who specializes in integrative therapies, they're more likely to step back and say, okay, you don't have diseases here. You're just not functioning correctly. So we need to do things to support your body to move forward.
I actually seen that Chinese herbal formulas work really well to just build back that qi and give a person that stamina and that vitality. So that brings me to my next question. Where does hyperbaric oxygen therapy fit into that picture?
The way to think about hyperbaric oxygen is that you have 3 levers or pressure points for the therapy. So you have how much time you're under pressure in the hyperbaric system. You have the actual pressure you're using. And then you have the gas mixture, whether it's oxygen and room air or some other combination thereof. So when you're thinking about the prescription of hyperbaric oxygen, you're getting 3 different effects that are all synergistic. One of the things we forget about, because hyperbaric oxygen, it's easy to be very mechanistic about it, which is true. It's a very mechanistic treatment. So the mechanistic stuff I'll talk about next, but there's a very important micro-mechanistic effect of hyperbaric oxygen, which is just in the research in the last 5 or 6 years for the most part. And that is that the pressure effect of hyperbaric oxygen actually creates a genetic effect and an epigenetic effect. So if you do have weaknesses, so genes are your code, but epigenetics are what turn them on and off. And it turns out that hyperbaric oxygen therapy, mostly through the pressure, is a kind of like a reset mechanism for the epigenetics around things that can either make your immune system work better or worse. So this is another mechanism by which we see prior to the hospital, if you can do hyperbaric oxygen and it physically just goes around your lungs and increases the plasma, your blood plasma carrying of oxygen, that on its own is helpful. And we've seen that with patients, and I saw it with myself. So hyperbaric oxygen can be quite useful. A colleague of ours, Paul Harch, who you know, in the United States, and he did a presentation for me 6 months ago at a conference, and he was talking about the Spanish flu pandemic, 1917, 18, and how they actually did do some trials back then with large scale hyperbaric oxygen use, and was very, very positive as to the outcome of people who were able to do that versus those who didn't. Now, of course, we're not dealing with the Spanish flu, but we have some similar things like lung inflammation, immune dysregulation, et cetera. So what I usually tell people is and again, this is an access issue sometimes. If you have access, or in your city, there's access to hyperbaric and you can do it, the earlier the better is good. If you are beyond acute COVID and you now have long COVID, what we have seen with patients is that adding hyperbaric oxygen into their other therapies, it helps to speed up a lot of the recovery. So in long COVID, you might have taste and smell problems. Those can recover faster with hyperbaric oxygen. You may have residual pulmonary problems, microclotting or things that have spread to your cardiovascular system. Hyperbaric can help with that. So it's because it's a universal treatment, it treats all of your cells, kind of doesn't matter where the problem is with long COVID. The hyperbaric can be a synergist to the other therapies you're doing.
What if I actually agree? I think 100% with that statement. I've seen people, including myself and my husband, recovering really well from COVID with the help of a hyperbaric chamber. And what we used was 1.3 atmosphere. So it was a soft chamber. Now with long COVID, I noticed that patients respond a lot better to higher pressures. That's just a personal clinical experience. So I wanted to ask, what's your experience with that?
Yeah. If you get to long COVID, a lot of times the damage is more diffuse. It's around your body. And sometimes in those cases, a higher pressure can help kind of break through the inertia of the disease and what it's done to you. So here's a practical thing people run into. They might only have availability of low pressure systems in their town. Right. So what I will tell them is it's sort of like, if you had something that was going to help you get better and you could drink a big glass of it, every hour, it would help you faster. If all you have is a little cup, it's still going to help, but you're going to have to do it more often. So low pressure systems like the soft, the 1.3 to 1.5 systems, those we will often have to have people do a lot of repetition. There was no limit to your options. My personal experience is we will do cell supportive or immune supportive IV therapy right after somebody does a hyperbaric oxygen dive. Now, let's say they don't have that available. They can't do intravenous therapies. What I recommend in those cases is that they do cell repair therapies and cell stabilizing therapies concurrently with the hyperbaric. So, for example, things to support the mitochondria, that could be a number of, we think of carnitine and alpha lipoic acid, CoQ10, also, mitochondrial support by some of the NAD precursors like nicotinamide riboside, other things. So mitochondrial support, but also membrane support. So go from the inside to the outside of the cell will give people phosphatidylcholine and other phospholipids they can take orally to help with that. We had another case that I presented was actually a COVID case. And these were twins who were born and within, I believe, a couple weeks old. One twin got COVID and the other didn't. So imagine that, poor parents. And then the twin that got COVID also had 3 other very bad infections that came down on them. And they got encephalitis, their brain swelled. It was very, very bad. And the neurologist told the parents and the grandparents that, the twin that was sick not only had COVID, which also affects your brain, but also had some other bad infections. And they, of course, treated them and they were able to get the infectious load down. But they said, the child will have a developmental delay. They were mentally incapacitated by all the brain inflammation. So we had these two twins, and one was thriving and the other one was in very bad shape. The grandmother actually is one of our colleagues, and the reason I knew about the case, they had called me and they had access to a hyperbaric system, and they said, would it be safe for a less than 1 month old baby, and here's what's going on. And so what I told them to do was, I said, yes, it's actually very safe with babies, works really good. Usually the parent goes in with the baby. So what I had them do was to put the baby on, and of course, little tiny babies can't take things like us adults do, but we give them a little newborn dose of some phosphatidylcholine to help with the cell recovery, and a little baby newborn dose of a couple of other cell support antioxidants. And they started to do, they were in a high pressure system, but because it was a baby, we started at low pressure and worked up a little bit. And because it was a baby, again, instead of putting a mask on them, they just had the oxygen piped in right next to the baby's face, so it was breathing pretty well. And so the mom and both twins would go in and do these dives. And so then they sent me updates as they went along. And at about 40 dives, now keep in mind, this is not your average post-COVID. This is an encephalitis case where the brain has been damaged. But at 40 dives, they were able to get the baby rechecked by the neurologist, and they said that both twins were equal and they both had the same amount of neurological function. So the effect of the hyperbaric on the recovery to the nervous system, just from the infectious, effects on the nervous system, was very remarkable. And most of our patients, thankfully, don't have that full complement of problems where their brain swells and, all of that. So I've seen hyperbaric be involved, very meaningful changes in COVID and post-COVID cases, but the only times we use it is in combo with cell supportive therapies at the very least.
That's a remarkable case, and especially because it's a little baby. I know it makes it a little more special, I think, that way. And I'm really happy that the child is doing well.
Yes.
I was curious when you were telling the story, why would the second twin go inside the chamber?
It had a lot to do more with the emotional bond that the twins had.
That's what I thought.
Yeah. And so, on the first, so they sent me a picture of the very first dive, and then as along the way, and then the later dives, about 40, dive 43, I think. And on the first dive, the baby who was affected was so diminished in function, it was sort of curled up in a partial fetal position. And the healthy twin actually just put its arm around it, through the whole dive. And, mom was there too. And on the last dive, they both look identical. They're both smiling and they're having a good time and all this. So it's really remarkable.
If people want to find you, where can they find you?
I have a website that's a hub for all the other things I do. So it's DRANOW, Dr. A Now. So DRANOW.com. And on there, there's a link to my YouTube page, which has a lot of the videos you've talked about. Also links to newsletters I've written and other things, books, etc. So DRANOW.com, dranow.com.
And you have resources both for patients and for practitioners.
Yeah. On that website, if you're a practitioner, you can navigate over to that side, or if you're a patient, you can navigate to the patient stuff pretty easy.
Dr. Anderson, thank you for taking your time and sharing your expertise and your knowledge. I really appreciate it. I'll have you back on a podcast. Definitely we'll talk about cancer therapies and the role hyperbarics has in these therapies. Guys, if you enjoyed this episode and you know someone who can benefit from this information, please send them a link to this episode. And otherwise, I'll see you next week.